Welcome to The Birth Breakdown, a minisode series from Her Birth, Her Story. These short episodes are here to open conversations around pregnancy, birth, and postpartum. Things I believe every woman deserves to look into, question, and just feel empowered by. You deserve to feel confident in your choices during your pregnancy, your birth, and even postpartum. This isn't about telling you what to do or what's right or wrong. It's about giving you space to think, to learn, and to trust yourself a little bit more as you prepare for birth. Let's break it down. Welcome to The Birth Breakdown, a mini episode of Her Birth, Her Story. I'm Brooke. Today, I want to talk about something we don't hear enough about, and that is preconception. Not in a pressure-filled way, not in a you have to do everything perfect way, but in an informed and intentional way. What is preconception health? Well, preconception health is evaluating and optimizing your health before pregnancy. That might be a month, that might be years, but it is evaluating and optimizing your health before that. Why does this matter? Well, this matters because studies show the better that you take care of yourself during your preconception health, better outcomes for your birth and your pregnancy. I think that it's great anyways because your preconception health, whether you're really actually wanting to have a baby soon, later, or maybe you're done having babies, but your health matters. So even if you just take it seriously now, you're just overall going to be healthier and you're going to establish healthier behaviors and habits. So if you're thinking about having a baby someday or even just open to it, these are a few things that I feel are worth looking into. First is your medical foundation. That could look like a preconception visit with a midwife, an OB, or even if you just reach out to your provider about optimizing your health. During this time, I think it's really important to review your health history, medications, how those medications might affect your pregnancy or what that looks like. If you've already had babies, talking with somebody about your past births and maybe things that you liked or didn't like and what kind of things that you can do now to maybe prevent those in the future with your future births. And one of the big ones that I think is very undervalued is lab work. Like getting your traditional biomarkers, but also getting your vitamin D tested, your iron, and your thyroid. A hormone panel is crucial. It is important that everything is working the way that it should. A lot of times when they check for thyroid, they only do TSH, but you want to make sure that they're doing T3 and T4. Even if you're not wanting to be pregnant, I still think lab work is crucial. Those biomarkers can tell us a lot about our body and can help us to optimize our health. But the other thing too is blood sugar. You want to look into your blood sugar and how it can affect you overall and how it can affect pregnancy, birth, and postpartum. Sometimes you have to supplement in specific areas to really help build up certain things in your body to help you have a better pregnancy and birth. Definitely ask your provider about what you can do. Another thing that it might seem silly, but gut mapping. Gut mapping is very important because your gut acts as a second brain. Your hormones are excreted through your gut. There's a lot of things that kind of go through your gut that if our gut is not working properly, it can lead to other issues. Next thing that you should look into is your cycle. Your cycle is full of information. They always say for women, it's one of our vital signs. You should be looking into your regularity, when you ovulate. Do you have painful periods? What about heavy bleeding? These are signals, not just inconveniences. Learning how your cycle works before pregnancy can be incredibly empowering, and that's exactly why we should be looking into these things. Next, nutrition. Preconception is about building stores, not just taking a prenatal. Protein. Protein's important. As women, we normally don't eat enough protein. 2 eggs in the morning is not enough protein. You gotta pair it with some meat or something. And then healthy fats. We're so scared of fats because we think that fats equal getting fat. No, healthy fats are crucial. Minerals and just your overall gut health all play a role in fertility and pregnancy. Mental and emotional health is just as important. And I know that when we're in the thick of motherhood, stress, sleep, anxiety, it all just can be there. And it's hard, but it is still important to try to prioritize those things. Do things that help minimize your stress, whether that's journaling, getting outside, making sure that you drink and eat before coffee or limiting your caffeine intake. Try to limit your stress as much as possible. And sleep. Listen, I'm in the thick of it with breastfeeding and stuff that can be hard, but trying to make sure that you go to bed at a good time in a dark room and just trying to optimize your sleep is crucial. You also want to make sure that you deal with any past traumas that you might have had because those can take a toll on you as well. And these all affect hormones and fertility more than we even realize because a calm, supported nervous system supports conception. Another thing that we should be looking into is movement. How does movement support our body? Well, you can do strength training, mobility, pelvic floor awareness, and rest all matter. I think there's a lot of value in strength training and mobility, especially when you're pregnant. There's a lot of things that are growing and changing, and already having strength and mobility before that is crucial. And also pelvic floor awareness. You should look into a pelvic floor therapists because they are game changers. I don't know why that's not just part of standard care. So valuable. Your lifestyle and environment are worth noticing as well. What kind of things in your environment and your lifestyle help encourage your health and support your health? And what kind of things could you fix? What about your working environment? Is it high stress? Do you sit a lot? What do those look like? And are they good and compatible with a pregnancy? Because small shifts can make a big difference over time. And finally, your mindset. Your beliefs about birth, your trust in your body, and the care model that you choose matter. This is a great time to start reading books, listening to podcasts, and just starting to ask questions about, well, when you're pregnant and you give birth, what kind of things do you desire? What kind of support do you want? What makes sense for you and your future baby? And this is a great time to have conversations with your spouse too about maybe what you expect, because preparing early can really make you feel confident later on. This is where education and informed consent begin. Preconception isn't about doing everything right. It's just about awareness, preparation, and just honoring your body before pregnancy ever begins. Thanks so much for listening to this episode of The Birth Breakdown. I'll see you next time, and remember, we are reclaiming birth one story at a time.